Good afternoon, everyone. My name is Amanda Porter, and I get the privilege of being the Child Life Specialist for our dialysis unit, kidney center, as well as our kidney transplant patients. Part of being a Child Life Specialist is empowering patients and families to have a voice in situations that are not normal for them, to allow them to feel comfortable advocating for themselves in a situation that is not normal. A lot of our patients spend a significant amount of time here at Children's Mercy, and so they become familiar with a lot of different areas in the hospital, some of those being the kidney center, dialysis unit, as well as our inpatient unit on 5 Sutherland. But there are often times that our patients, your child, is going to have to travel to different areas of the hospital. And I want to use my time today to empower them to feel like they have a voice in those areas, encourage them with tips on how to advocate for themselves, to speak up for themselves so that they feel that they can ask questions when they don't recognize a staff member in a new area. Because there are going to be times where they're in a place that is unfamiliar to them. Let's first talk a little bit about what does it mean to be an advocate. Being an advocate is someone who stands up or sticks up for someone or themselves. This is going to look a little bit different for each patient and each family, as everyone copes differently with being in the hospital or having a procedure done. But you as the family know what works best for your child, and being able to feel comfortable that you can advocate and ask for those things is so important in a child's hospital journey. So today I'm going to give you a few tips on how to make that happen, or ways that you can utilize your voice to get a positive outcome for your child. First off, I want to start with a story. We have a fellow transplant mom who is willing to share a little bit about her story. She advocated for her child while he was at the hospital, and a positive outcome came from it, which is what the goal is every time. Here at Children's Mercy, we are patient and family-centered focused. So we want to ensure that every encounter a patient has here is positive and that it's a good experience for them, even in a place that isn't the most fun place to be. Here are a few tips that you guys can use in future visits to the hospital. First off, let's talk about how you're the expert. This is true of both the patient and the parent. You both know what works best for you or what works best for your child, whether that be Emla cream for a port access, J-tip for an IV, or no topical at all when they're having a procedure done. It is important that a child have consistency or a bit of a routine when they get these continuous procedures done. And you as the parent or you as the patient know it's going to work. And I want you all to feel comfortable when you're in an area that isn't normal for you, whether that be the emergency room or one of our additional outpatient clinics, to say, hey, can we use the Emla cream? Do we have time for the port? Or do we have time for the J-tip? Or whatever that might be, or whatever that looks like for your patient, or for you as the patient, or for your child. We want to ensure that you know that you have a voice that can be heard. Secondly, I know that nurses and doctors are the expert, and I don't want to discredit that by any means. But once again, you know what's going to work best, and it's okay to stop and ask a question. It's okay to say, hey, we prefer Child Life, can you call them? Or we really like it when our son has the iPad, or whatever that means. Even if it's simply like, we want someone to just come and talk to our patient, or talk to me or my patient while they're getting their procedure done. Whatever it is that your child or you as a patient uses to cope, we want to make sure that you're getting that anytime you're here at Children's Mercy. and that starts with feeling comfortable enough to voice those concerns, to ask those questions, and to advocate for yourself or for your child. I think one of the biggest things we hear with our kids who have to have dressing changes or port accesses is they've been in a situation where a staff member isn't wearing a mask or they didn't wash their hands. And I want you to know that it is absolutely 100% okay for you to say, my dialysis nurse taught me that anytime I'm getting my dressing changed, anyone in the room has to wear a mask. Or the infusion nurse taught me that anytime my port is accessed, anyone in this room has to wear a mask. Those are important things. We teach you guys those because there's a reason for it. We don't want infections. We don't want you to have to come and stay at the hospital for any reason. And so it's important for you to feel comfortable saying to that staff member, hey, this is how we do it down here. And if you want, you can even say, like, can we call my dialysis nurse, or different things like that. Another thing is the washing of hands. That is so important prior to a dialysis dressing change. And I want you all to feel like you can make that statement, like, did you wash or asking questions of, did you wash your hands, or however you want to phrase it in a polite way is absolutely beneficial and important. Next up is asking physicians questions. Your doctors, I can guarantee you, thrive off of getting questions from you guys. It kind of gives them a sense of pride because they know that you're paying attention to what they have to say. They know that you are playing an active role in your healthcare, and they know that you're listening, and that's huge. I can promise you that it makes a big difference in their day to know that you are actually paying attention. So please feel free to ask your doctor a question. You can do it a lot of different ways. You can write it down on a piece of paper. You can write it on the whiteboard in the Kidney Center exam room. You've got a lot of different options, but we want you to know that it is absolutely okay to ask questions to your physicians. They love it, seriously. I want to explain to you guys about a new initiative that is going out here at Children's Mercy. It actually started 2 years ago in our inpatient units, so units like 5 Sutherland and the PICU. And it's what we here at Children's Mercy call the Comfort Promise. And the Comfort Promise is 4 different steps to ensure that anytime a poke takes place, whether that's an IV, a lab draw, a port access, the 4 steps that we utilize in the Comfort Promise, the first one being a numbing cream or a topical. Not always a numbing cream. I know we use a numbing cream for our port, sometimes for our IVs or our lab draws. We also have the J-tip that's possible. Basically, this is giving the patient an option to have the location of their poke numb so that they don't feel it. We want to provide this opportunity to every child because it's important, because any time that a child has one bad experience in the hospital, but especially with a poke or a needle, there's a lot of research that states that in the future they're going to continue to have difficulties with those types of procedures. And for as often as our kids, your child, or you, the patient, are having to visit here, we want to ensure that we're providing positive opportunities and positive encounters. Secondly, we have what's called sucrose or breastfeeding. One of the best ways for an infant to cope with anything that's difficult is to be breastfed if the mother is breastfeeding, or we have a sugar water that can be placed on a pacifier. These 2 options are soothing for the child to promote a positive experience for them. I'm not going to say that the sugar water works for every child, but it definitely is an opportunity to promote positive coping for an infant during something that's difficult. Third option is what we call our comfort positioning. So this provides an opportunity for the patient not to be held down, but to sit in a place where they feel safe, whether that's in the mother's arms, the caregiver's arms, or the child life specialist's arms. A lot of times kids have a fear of the needle and things like that, and so if we can provide them in a safe comfort position, a safe, tight feeling kneeling position, it promotes more of a positive coping for them, which is always the goal. And so this is an opportunity to really promote that positive environment for a child during something that's kind of stressful. Lastly, the last part of the comfort promise is what we call distraction. This is an opportunity for patients to be able to focus their mind on something else that's more positive during something that might be considered difficult. A lot of times what you'll see us using as positive distraction is an I Spy book, bubbles, spinners, and our famous, absolutely most popular item is our iPad. I know that there's a lot of heat given with iPads and the topic of iPads, but I think absolutely 100% this is an important distraction item that any child life specialist, any parent can bring to a situation, to a procedure. Because if a child is able to positively complete a task while also having to undergo something negative, something difficult, it trains their mind that they can do hard things. And that is such a valuable tool that a child can have moving forward, especially a child with a chronic illness, someone that's going to spend a significant amount of time in the hospital. This really allows them to see that they can do hard things, and that's, like I said, extremely valuable. To touch a little bit on the distraction portion, a lot of times that is what our job is as a child life specialist, that positive distraction, that reinforcement during those difficult times. And I want you to know that there's been a lot of discussion of how often is Child Life available? When are they here? And I want you to know that Child Life here at Children's Mercy is available from 7 a.m. to 11:30 p.m. 365 days a year. That is at both our Kansas location as well as our downtown location where the Kidney Center and Dialysis Unit are located. This is an opportunity for if your child is inpatient, if your child is having to have a procedure done late at night in the emergency room, that you can let the staff know, I would like Child Life to be called. Now, please note that it may not be your preferred child life specialist, but fortunately, we are all trained with the same tasks and skill sets to be able to perform procedure support or to help distract a child in a procedure. So please welcome any face you see with open arms. There are also going to be times when you might be in a different outpatient clinic besides the Kidney Center, and maybe your child is getting scheduled for a procedure that you could perceive to be a little bit difficult. Feel free to let your kidney transplant coordinator know, your dialysis case manager know, whoever you can that you would like Child Life present for that procedure, and we can make sure that it's scheduled on the calendar. Because we want to ensure that there's that positive coping at any chance we can get. Also, if it's during the work week, your typical child life specialist who you prefer likely could provide that support. And we would love to provide as much consistency, familiarity, or normalcy as we can. Lastly, if there's ever a time that someone tells you that they don't have child life, this is pretty rare situation. Although we are housed 7 a.m. to 11:30 p.m. all year long, there are times when we have to make adjustments to our schedule. But for the most part, physicians can put in an order for Child Life. It goes automatically to our phones as a consult, and we are able to go to wherever that procedure might be, whatever that need is, and provide support as long as we are in-house. So please always feel free to ask for Child Life. It's not just Monday through Friday, 8 to 5. We are very fortunate to have the ability to have our Child Life specialists here as often as they are, for as long of hours as they are. Lastly, I want to talk with you all a little bit, or share with you a little bit about what we call our Thrive Guide. The Thrive Guide is an opportunity in each patient's chart or medical record for any member of the healthcare team to put a note about that child, whether it be their coping tools or any type of situation that might make that hospital stay better for that patient. My goal for the next 3 to 6 months is to get everyone a Thrive Guide created in their medical record or chart that states their POC plan. So this is kind of going back to that comfort promise. So this is going to say, like, my child prefers the J-tip. They want to sit on their mom's lap and they want Child Life to distract. Or my child prefers EMLA cream, wants to sit alone, and prefers to play with toys. Because at the end of the day, we want to be able to say, when you walk into the emergency room, when you walk into 5 Sutherland, or you walk into any other clinic, that they can pull up your Thrive Guide and say, oh, I see that you have a Thrive Guide for your POC plan and this is what works. Perfect. I think there are a lot of times that we want to feel like we are empowered, or we want to be able to advocate for ourselves or for our child, but the reality is that's not always the case. We're not always comfortable. And the Thrive Guide, the goal of the Thrive Guide is to provide a little bit of an empowerment, but more of a hey, my kid has a Thrive Guide, and not having to go into detail and feel like you might get shut down. So my goal is over the next 3 to 6 months to be attending clinics and visits so that we can figure out a POC plan for each child. If they want one noted in their documentation, like their chart or their medical record, so that when you walk into a new area, you can say, my child has a Thrive Guide. They can look it up and then know all the information they need to know about how your child copes. That could also be information for how your child copes with a general hospital stay. Maybe they're really anxious, and it'd be good for the medical staff to know that. So at the end of the day, this is going to be the reason for the Thrive Guide is to promote positive coping and to assist you as the patient, you as the parent or the caregiver, to feel empowered to advocate for your child, which is huge. So I hope that these tips were beneficial for you. I wish I were there to answer any questions you might have, but Kelly Scott is going to come up and facilitate any questions that might be had. I will leave my contact number at the end of this video and my email. Please feel free to get a hold of me if you have any questions, or you want to message me your POC plan or whatever you really need to talk about. But thank you so much for listening.